Ludwina was a warm, caring person.
She was amazing. She was fearless. She just knew that she could handle whatever situation came along, and she just did. She had a neighbor that was a single mom, and she had bad health and she couldn't go to the doctor. She didn't have the money to pay.
Lidwin Durney saw that and said, this isn't acceptable, and she decided that she would start a clinic for people that couldn't afford medical care.
From 1985 to 2004, the clinic operated as a volunteer clinic. It operated 2 nights a week.
We had an exam room and an otoscope and some tongue depressors, and we had some volunteer lab techs who could do UAs.
They would see between 45 and 50 people a night.
There would be a line of people there an hour or two before the clinic opened in the evening.
People snaked around the block waiting to be seen.
They could clearly not meet the need for people that had no other place to get health care.
I started over there when it was the Women's Center. Been with them ever since, and that was when I didn't have insurance. They really helped me out when I needed them.
When the move was to try and meet the need, they needed to get larger and they needed funding. The best way to do it was to become a federally qualified community health center.
From 2004 until now, they converted it into a full-time clinic where we employ our physicians. We hire the greatest doctors around. We just continue to provide that same great care, but you can come see us every day of the week, and we have sites in 9 locations in 2 counties. From the very beginning, healthcare needed to look different. We had people that couldn't access healthcare, and they kind of created this idea that if we bring the right people together, something amazing will happen.
I think if you want to change medicine, you need to start with providers who are interested in that patient's outcome.
It's patient-centered care. It's care that is based on what the patient needs. I'm a patient at Heritage Health, and they're looking at what do I need.
Healthcare really needs to be all about the relationship. And for many years, that relationship's been pushed out of the healthcare experience, and what we're trying to do is really bring it back.
For a long time, Durney just wasn't a real doctor's office. It was just a place to go when you couldn't go anywhere else. And it's just not like that anymore. We've got, world-class providers.
One of our physicians, Dr. Michael Whiting, he says we're building a healthcare system that's so great that even patients with health insurance want to be a part of it.
The dollars that my insurance coverage pays to Heritage helps to pay for those people that don't have any insurance, that can't afford care.
People's health is so fragile, and they deserve the best, and they're getting it.
This will be the place that people go to get better and to find themselves again.
You walk in and you walk into love.